What does it mean when we talk about social isolation and stigma and global health? What happens when a phrase like foreign virus is casually expressed through the media and countries are blamed for a pandemic? From the plague, tuberculosis, polio, influenza, and now COVID-19, global health has wrestled many serious pandemics. However, COVID-19 has also taken on a political force that carries negative cultural implications. Hi, my name is Professor Kimberly Chakra, and I would like to introduce a course that I'm very excited to teach this summer called Cross-Cultural Perspectives in Global Health, XC398. Because this is a brand new course, I wanted to take some time to describe the class to you. The course offers a unique project-based learning experience in which student teams from across BU's undergraduate colleges develop leadership, teamwork, and communication skills. This course contains 3 hub units: oral communication, research and information literacy, and teamwork collaboration. Our project will be designed around ways to inform the BU campus and the surrounding communities about COVID-19. Students within the project will explore how cross-cultural perspectives can inform and counter false ideas about COVID-19 and help prevent further cultural stigma. Students can better position themselves on making their proposal by exploring questions such as, how has globalization changed the way we look at health, and how have the stereotypes and expectations of what wellness actually means influenced these perceptions? And to what extent has both the BU campus and surrounding communities suffered from cultural isolation created by false information surrounding COVID-19? Now I'm going to take some time to describe the deliverables that will help inform your projects. The first deliverable will be a collaborative research essay based on a cross-cultural global perspective. With a partner, you will explore and compare the handling of COVID-19 with the US to another country. You will investigate how cultural diversity has affected the reactions and perspectives of the pandemic, and how the perspectives, whether false or true, influence the overall quality of health and safety of its citizens. After the written assignment, each student will share their findings in a 7 to 10 minute oral presentation. Now, I know that the course will be taught virtually, but students can still write collaboratively together through Google Docs. Another deliverable will be team contracts, and through this course, students will receive explicit training in TLA, Team Learning Assistant software. This software will cultivate students' ability in teamwork and sustain experience of collaborating with others. Students will be able to identify the characteristics of a well-functioning team. Another deliverable is another individual research-based essay, and this is based on the political impacts of COVID-19. And this assignment will ask students to wrestle with questions such as, how is the virus taken on a political force that carries such negative cultural implications? And how has politics changed the way we look at health, and how the stereotypes and expectations of what wellness actually means influence these perceptions? Now, during the course, students will be working on their final deliverables, the final presentations. And these will look like, some of the things that students can do could be a series of podcasts that inform the BU campus and public about what's going on with COVID-19. They could also present a town hall, and I have an example here that I'd like to show you what CNN has done with Anderson Cooper and Sanjay Gupta.
Hello and welcome. I'm Anderson Cooper in New York.
Hey, Anderson. I am Dr. Sanjay Gupta, and this is the CNN Global Town Hall, Coronavirus Facts and Fears. Tonight, CDC Director Dr. Robert Redfield will be joining us to answer your questions about coronavirus.
Also about what needs to happen before the country can reopen. Multiple sources tell CNN the White House is looking at a date as early as May 1st, though it may be later. Just this evening, President Trump told our Jim Acosta during the daily coronavirus news conference that there'll not be mass coronavirus testing for all Americans as the country goes back to work. Quoting the president, we're talking about 325 million people, and that's not going to happen, as you can imagine. Talk to Dr. Redfield about that.
Also joining us tonight, NBA Hall of Famer Magic Johnson, on why the pandemic appears to be affecting African Americans.
Another deliverable that students can work on is they could create a short film. And I'd like to show you something that Jake Tapper has been working on. He did a special on CNN called "The President and the Pandemic," and there is a series of specials. And here I will share.
I can tell you that there is a significant amount of evidence that this came from that laboratory in Wuhan.
Your Office of the DNI says the consensus, the scientific consensus, was not man-made or genetically modified.
That's right. I agree with that.
So just to be clear, you do not think it was man-made or genetically modified?
Here's what's important. The Chinese Communist Party had the opportunity to prevent all of the calamity that has befallen the world.
Thank you for listening. I hope that you'll consider taking this course and that in time of so much uncertainty, through research, teamwork, and leadership, we can help the BU and surrounding communities navigate towards the truth, fight against false information and cultural stigma of COVID-19.